Hey, it's Patty. In this presentation, I'm going to talk about the general presentation of mast cell activation syndrome, kind of a global overview of the condition and mast cells and mediators. I'm just going to touch on a few things here and there, and we'll break this down for simplicity in other videos and also for more specificity in other videos as well. But here's just a general overview of the condition as a whole. So what is mast cell activation syndrome? Well, let's rewind it back. What are mast cells? And mast cells are what respond to what we consider foreign invaders or an injury that happens in the body. So they're responsible for determining how much help is needed and what type of help is needed in certain tissues to hopefully actually restore the tissue. If there's an injury, what do we send so that it breaks down the material and then rebuilds it? Right? So we actually need these mediators to be released: histamine, prostaglandins, leukotrienes, platelet aggregating factor, thromboxane. All of these are like the integration of the immune system that hopefully has beneficial outcomes, right? Normally, those reactions do keep us healthy. They turn off at some point. The body does what it's supposed to do, and then it recedes and it lets the healing continue to occur without these inflammatory mediators. However, in somebody with mast cell activation syndrome or mast cell activation disorder as a whole, there's either too many mast cells, or with MCAS, there's an inappropriate response from the mast cells themselves. So there's a miscommunication from the mast cells to the mediator, and we're not getting the effect that we are hoping to see. It's not a normalized reaction to whatever the threat is that's sensed in the body. When we look at mast cell activation disorder, that's the umbrella term. So mast cell activation disorder does include mastocytosis and also mast cell activation syndrome. Mastocytosis also has a plethora of different diagnoses that falls underneath that category. With mastocytosis, it's typically an abnormal number of mast cells compared to mast cell activation syndrome that is an abnormal response from the mast cells, typically releasing too many mediators. So a little bit different. And then there's theory behind the idea that we might have primary mast cell activation syndrome, secondary, and then idiopathic as well. So with primary, you have something genetic in your genetic makeup that makes you prone to abnormal mast cell activity. Secondary MCAS, the theory is that you have something that occurs to you that just tips the scales for your immune system, and your mast cells start to respond abnormally because they can't come back to their stable baseline that they were at before. So not necessarily genetically predisposed, but something happened enough that's tipped the scales, and now there's abnormal mast cell reactions. Idiopathic is don't know where it's coming from. We don't know if it's something in genetics or if something happened to the individual, or there's just abnormal mast cell activity. So different schools of thought on where this might be. The important thing is understanding what is irritating somebody's mast cells and then how to treat it. So those mast cells, they a really important role that they have in the body is this communication piece. So they are responsible for interpreting what's happening in the body and then sending out the appropriate mediators to take care of it. They're found in all different body tissues, and again, they're supposed to be helpful with the body's defense system. I like to call them like these little air traffic controllers. So they are the ones that, like I said, they're interpreting what's happening out there and then who needs to do what where to have the appropriate effect, right? However, again, if we have an abnormal mast cell reaction or poor communication, it might send too many of the mediators, or too many of the not helpful mediators over to an area, and it might not turn them off as well. And we can have that abnormal mast cell activity. They are everywhere. Mast cells are everywhere. And this is where it can be very confusing when you're looking at somebody that has so many symptoms and so many different systems, that it might be something regarding a mast cell dysfunction. So pulmonary system, so that respiratory system, lungs, respiratory passages, cardiovascular, our heart and arterial and venous system. Dermatologic, so the skin; gastrointestinal, our gut, especially high level of mast cells there; musculoskeletal, and also our neurological system as well. So Yes, you can have multiple different systems affected depending on what your personal presentation is, and possibly on what triggers the mast cells thinks that it's helping with, and that might be where the focus of the reaction is happening. So again, it can be very confusing because somebody with an abnormal mast cell presentation can look like they have like 20 different diagnoses that are happening, but it might all be stemming from an abnormal mast cell component that is affecting multiple different systems. And I'm not going to read through all of this, but this is a great article that's out there. But it just talks about the different types of mediators that are out there. We have a lot of different mediators. I know that we talk about histamine so much, and it can be helpful for some people. But there are other mediators in the body. There are hundreds of other mediators that could need help or assistance. So especially when we're talking about treatment, we want to make sure that we're treating the patient appropriately or the individual that needs help. Are we treating the right thing that needs additional help? Possibly. This is broken down from a couple different articles. And again, there's hundreds of different mediators, but this just represents some of the ones that maybe we more typically talk about with individuals, but they can come with different symptoms. And this is not saying that people with histamine problems will only have these presentations and none of the others, but maybe they have a heavier balance of flushing, itching, diarrhea, low blood pressure, food sensitivities, and things like that. If somebody has a histamine problem, leukotrienes, perhaps there's more of the respiratory type of presentation with shortness of breath, sinus infections, exercise-induced asthma, and chronic bronchitis. Prostaglandins, there might be more flushing and bone pain and brain fog and cramping. And sometimes we see more of this pelvic inflammatory response with the prostaglandin piece with things like pelvic inflammatory changes, polycystic ovarian syndrome, possibly endometriosis might be related as well. Tryptase, I know this is discussion in testing, but tryptase as a problem might cause some of these skin lesions and osteoporosis. But again, it might not just be tryptase that's the problem. It might be other things. And we can't always guarantee that if somebody's having a mast cell reaction that all of their mediators are elevated. So if we're just checking for tryptase, we might miss that they have a histamine problem or prostaglandin or whatever it might be for the individual. Um, Interleukins, fatigue, weight loss, and large lymph nodes can be a problem. Heparin can come more with osteoporosis, problems with clotting and bleeding. And then tumor necrosis factor alpha can come with headaches, fatigue, and body aches as well. So more of the fatigue type of syndrome. So just something to understand that to emphasize to those out there that mast cell treatment, which we'll talk a little bit about, is really individualized. It should be individualized medicine based on why the person's mast cells are irritated and then what their mediators are doing. So signs and symptoms, it's everywhere again, okay? So I'm not necessarily going to read through all of this verbatim, but we can have teeth and dental issues for sure in an individual. One of the areas that has high mast cell concentration is actually the mouth. So we do see some stuff that happens in this area. So not just teeth and dental. If we look down at the mouth, burning mouth syndrome can happen for some people, ulcerations and sores. So just like the skin, we can have some of those reactions that happen within the mouth as well. Um, with mast cell abnormal activity, we might have some hearing loss, ringing in the ears, also vertigo, if there's any issues with the vestibular system for the individual. Eyes, I actually hear a lot of people complain about eyes, dryness, things that might overlap with Sjogren's as well, blurred vision, irritation, twitching, a lot of things can happen around the eyes. Thyroid issues can really be influenced by that immune system response, right? With an abnormal mast cell presentation, it can influence what's happening at the thyroid and cause inflammatory changes there as well. Respiratory system, there can be so many things. I tell people from the sinus cavity all the way down to the lungs, anything can really pop up on a chronically irritated spectrum, right? So this group that maybe has this chronic asthma that's kind of exercise induced, but not really, that maybe we want to start thinking that there's a leukotriene or, a mast cell issue within the respiratory system. Just something to consider if you've had chronic respiratory issues and also a mast cell problem. that we might want to find somebody that focuses and understands how to focus treatment within that respiratory passage. Heart and circulation, there can be a lot of things that happen with abnormal mast cell activity, and there is this crossover between POTS and MCAS, and that's has to do with mast cell degranulation and release of neurotransmitters, and they get into this bad cycle together. But POTS is associated with abnormal mast cell activity. Blood. So blood is it is a system in and of itself. And what we see a lot is actually a lot of abnormal blood tests. So when your immune system is overreacting and over-responding in different areas of the body, you can have a wide variety of abnormal test results that come back, and nobody can really explain for you abnormal liver test results, or abnormal blood clotting responses and things like that. We just want to make sure that perhaps if there's a mast cell component, we actually might find improvement by treating that and reducing the inflammatory effects in the body. Gastrointestinal system, I feel like this is actually a very small parentheses area for the gastrointestinal system, because there is a ton that happens with abnormal mast cell activity within the GI system, and it can range from any side of the spectrum to the other. And for that reason, I'll actually be talking a little bit more in a whole nother presentation about the crossover of mast cells in the GI system when I post a little bit more about the gastrointestinal system specifically. But understanding that your lining in your GI system has a lot of mast cells in it. So if something is happening abnormally at that level, it can cause inflammation throughout the gastrointestinal system. Diabetes, and this is more of that autoimmune inflammatory response that can influence the presence of diabetes for some individuals. Liver and gallbladder issues, especially abnormal blood tests, for liver testing that we do see. But also what I do see a lot is this neurovascular response that can happen and cause gallbladder type pain, liver vascular pain that might be happening in that area. The pelvic area is a hotspot for abnormal mast cell activity, unfortunately, but there can be a lot of things with inflammatory reactions in the pelvis that are related to abnormal mast cell activity. Musculoskeletal system, I think sometimes we forget that somebody that comes in that might have some form of connective tissue pathology that starts to complain about things popping up. Both of my knees started hurting, my wrists are starting to hurt. That yes, they might have a connective tissue disorder and some laxity, but isn't it weird that both sides started hurting and they can't remember what started leading to the pain? That we want to hit the pause button and think like, hey, maybe that's something systemic causing joint inflammation, especially on both sides. So one of the first things to look at, of course, considering a connective tissue issue, would be abnormal mast cell activity, because that can cause joint pain and bone pain, muscle pain, tendon irritation. It can actually cause all that. So we just want to make sure that that's been looked at for people that are having more widespread complaints. Nervous system in the brain. This is mast cells. They live in harmony or not with the neurological system. So this is really that neuroimmune crossover. And this is something that in other talks, I will go down rabbit holes with, because when we activate that neuroimmune response and we don't turn it off, it can really lead to a lot of impairments for individuals, chronic neurological presentations that are debilitating for many. And we really have to work on the combination of the neurological and immune system at that point. Restless leg syndrome is something that has been associated with mast cell activity, although causation versus correlation is not something that we know yet, but perhaps there is an inflammatory immune component to restless leg syndrome, perhaps. The lymph system. So yes, of course, if we have abnormal mast cell reactions, abnormal immune system reactions, then we might have abnormal lymph movement as well. The skin, lots of mast cell stuff that can happen at the skin, like flushing and hives and lesions and things like that. So that can either be local to a small area, or it can be global in larger parts of the body. And then sleep disorders and insomnia are also reported as well. Now, when we talk about things that trigger mast cell activation syndrome, it's not necessarily what we consider to be a threat to the body. It's what the mast cell considers to be a threat to the body on that day. for whatever reason it decides. It's kind of how the body is sometimes. So these are some more common triggers, but also to understand that when somebody gets so ramped up with abnormal mast cell and immune system function, that they might have reactions to things that had been safe before, or they just don't know what they're going to react to, and it's not always, consistent for them. So just something to understand that these are the typical ones, and you could also have a lot of other variety of triggers as well. But when the mast cell label something as an invader or a foreign body, or I don't feel comfortable with you here, that's where it actually starts to have this cascade of mediator activity. Now, this can actually happen with exercise. So typically too much. So over exercising can cause this mast cell degranulation to happen. Temperature shifts, too cold or too hot. Humidity shifts for individuals as well, that trying to regulate the barometric pressure. There are allergic type triggers as well. So insect bites, any venom or foods for an individual, whether it's particular food sensitivities or high histamine related foods. And then alcohol sensitivity. A lot of people do report that have abnormal mast cell activity, and that's because of the higher levels of histamines within alcohol. Certain drugs, medications, and supplements, I'll have a little slide on that for some medications anyway, that actually might increase that mast cell degranulation again. Stress and anxiety, and this is not to be taken lightly, and this is also not to say like, oh, everything is stress related, but stress does cause a domino effect in the body that is physiological and causes inflammation. And the abnormal mast cell responses can be part of that mast cell degranulation and release of these mediators, perhaps too many of them. So yes, stress and anxiety can be a trigger for those that are stuck in this abnormal mast cell cycle that they're in. Pain, and this is where like chicken or the egg scenario, pain flare-ups can trigger mast cell episodes. Also, mast cell episodes can trigger pain. So what I tell people, like, it doesn't matter if the chicken or the egg showed up first. If the chicken and the egg are at the party, you're going to take care of both of them, right? Fatigue, actually, so it's basically that overexertion again, right? You did too much. Now your immune system is starting to recognize that as a threat to your body, so it starts to work a little bit too much if you have overexertion. So if you are too fatigued, you actually might trigger a mast cell reaction. And it's also that chicken or egg scenario for that as well. Infection and illness, very, very common reason for mast cells to become angry is if you come down with a virus or a cold or whatever it might be, that is going to absolutely trigger a mast cell reaction. Odors, pollutants, and smog, so environmental toxins can certainly irritate things. Sun and sunlight, for those that react on the skin, it is a thing. There's a lot of people that have mast cell reactions, not just sunburn, but mast cell reactions on the skin or systemically that are exposed to sunlight for too long. Mechanical irritation, so if something's rubbing on the skin, it's not just like a rubbing flushing type of response, but you can actually have an abnormal skin response, lesions, welting, and things like that. Dysautonomia flare-ups, so and chicken or the egg again, right? Because of this cycle that the nervous system sits in with the mast cell activity. So that's where if you can't figure out where to get access to in an individual, if you really feel like it's a mast cell type of reaction, but nothing is seeming to affect it, how about treating the dysautonomia? Does that help at all? Because they really go hand in hand, and that might be backdoor access to find a little bit more relief in. Okay, so environmental triggers are super common. These are just some of those, and it can be a world of other things for individuals. But just for people to understand, and especially if you're listening to this and maybe you don't have the condition, but maybe you're a provider that has an area that you host individuals with this condition, or you're a family member, it's nice to understand what might be helpful to have in your house or get rid of in your house to make that person's immune system a little bit more comfortable, right? Odors and smells. So those that are especially highly mast cell irritated. So it's very hard to stabilize their mast cell activity do tend to respond a lot more to noxious odors, which a lot of us think, oh no, it smells nice. If it smells strong, that's the problem. So remember, it's just about how the body is perceiving what it's taking in, not necessarily what it's taking in. Cleaning agents and laundry detergents actually do tend to irritate some individuals out there that especially have the nasal or respiratory presentation. Mold. Mold can be a significant trigger for those with abnormal mast cell activity. It's an immune system response. It doesn't want the mold there. It kind of creates this it's a very strong domino effect throughout the body. Dust can be irritating, body care products, venom. So again, anything that bites or comes into contact with the skin that has any venomous qualities can be irritating, like plants as well. So poison ivy, oak, and giant hogweed. Pesticides. So again, environmental triggers that we probably shouldn't be having a lot of around us. Those with abnormal mast cell activity should not be around. These amalgam fillings, and this is very individualized. I've seen people have them removed and they do great, and some people have them removed and it didn't change anything. So it's really this bucket analogy of, and it's everybody has their own personal individual bucket of their own triggers. It's not going to be the same person to person. Not every single person with MCAS is going to be treated the same way. They should all be treated differently. So that's where maybe it is some amalgam fillings for some people that's going into this bucket, and maybe their system is okay with it. Temperature extremes, so again, flipping from hot to cold. And unfortunately, this is one of the problems that we just have with modern society, is that we have taken away our body's ability to adapt to fluctuating temperatures. So not recommended right now for starting practice, but for those that do seem to have those triggers, it is actually beneficial way down the line to retrain your system how to safely respond to changing temperatures. But we have air conditioning now, and we have heating systems that keep us in a neutral place, which is great, but sometimes we actually do need the exercise. Changes in barometric air pressure, sun sensitivity, we talked about some of these, common allergens like the outdoor allergens, and bed bugs. Okay, dietary triggers for mast cell activation syndrome. There's a ton of them. And this is really individualized. It could be like genetic food sensitivities based on your microbiome. So just understand this really needs to be worked with a professional because we don't want to further limit somebody that might already feel limited in food choices. We actually want to expand it first if possible. So if you feel like you have dietary triggers, please go talk to somebody who understands the mast cell components, because I don't want you to think I have to take all these things out because I have mast cell activation syndrome. No, maybe not, maybe not. But just to understand that those that are more sensitive to pesticides might have a reaction to fruits and vegetables that have pesticides on them. We talk about histamine a lot, and high histamine containing foods might be irritating for some individuals, and that's things like alcohol, tomatoes, chocolate, spinach, fermented foods, citrus fruits, things like that. Okay. Individual food sensitivities are going to potentially cause a reaction. And then you can have these random inconsistent food sensitivities. So that's not necessarily that you are sensitive to the food. That is that your mast cells are deciding to respond to that food as a threat today. So that can be very confusing for individuals. And again, it's really important to work with somebody that understands what might help, some DAO supplementation or extra mast cell stability. There might be some treatments for that, and it's usually getting the mast cell more under control rather than specifically going after foods. And with the mast cell piece, so we talk about allergic reactions, which that typically happens in seconds for people. However, those that have abnormal mast cell activity usually have this delayed reaction where it takes minutes or even like the next day to respond to food triggers. So there is a little bit of a difference in the response for some individuals. Okay, physical triggers. I don't think that we talk about this enough with abnormal mast cell activity, but there's a lot of things that can be an irritating physical trigger, right? So we have these chemical triggers. That's kind of obvious. Like mast cells deal with chemicals all the time, but they translate our physical activity and what our body is physically experiencing, also with these mediators and how the mediators respond. So psychological and emotional stress can cause abnormal mast cell activity. These strong visceral emotions, remember, it's going to stimulate different neurological pathways, which causes the release of neurotransmitters, which can cause mast cell degranulation. And if you don't have normal mast cell degranulation, those strong visceral emotions, even for some people, being so happy can actually cause a mast cell reaction. Self-negativity, again, it's just these different neural pathways that we're stimulating with these neurotransmitters that really like to have a conversation with your mast cells. Extreme mental exertion. I think a lot of people with mast cell activation syndrome know this, but maybe need the validation of somebody saying, yes, if you work your brain too hard. So again, it's the neurological system. If you're overstimulating that, you can cause abnormal mast cell activity because again, it's your immune system responding to neurological input, and it can definitely happen. High episodes of sexual arousal. So you can actually have abnormal mast cell reactions from sexual intercourse, or for some people of climaxing and coming from a sympathetic state to that parasympathetic state very quickly. Again, we're talking about the communication with the neurological system. Stimulants. So caffeine for some people can actually cause a mast cell type of reaction, physical overexertion, any mechanical stimulus. So we kind of talked about things on the skin, menstrual cycle fluctuations, and with this is more so relating to hormonal regulation and changes. There's this increase in estrogen as we work towards ovulation that causes mast cell degranulation. Typically, we see this starting around 3 to 5 days before the period starts, and then increasing over a little bit of that timeline. Again, hormonal dysregulation is if we have something going on there, it can actually affect the mediator response that's happening in the body. And then bacterial, viral, parasitic infections can drive abnormal mast cell activity. If you have a chronic underlying virus that's just not going away completely, that can constantly be stimulating abnormal mast cell activity because it thinks that there's still an active invader or foreign something in the body that needs to be addressed. And it might need to be addressed. So that's where the idea of the chicken or the egg for this immune system component versus mast cell, are the mast cells being driven by the fact that somebody has an underlying infection or chronic viral load or chronic toxin or whatever it might be? Yes, it might be for the individual. How you treat that can be very complex and tricky. So you want to make sure that you're seeing an individual that understands the mast cell component and also this chronic immune system load component. And then I'm not going to read through all of these medications that are listed here, but just to understand that there's actually a lot of medications that can cause mast cell degranulation in individuals. And these are them that, well, this is actually now I'm like, this is a long time ago, 2016 from this article. There might be new information out, but not a bad list to start with on different types of medications that might be noxious to somebody with abnormal mast cell activity. So not saying that there aren't other alternatives. Please talk to your medical provider, but just something to understand if somebody's about to prescribe something for you. You just want to make sure that that it's possibly not going to cause a reaction, or that you have a rescue plan set up with your individual if you feel like one of your medications is. So different management strategies, and I'm not going to go down the rabbit hole with all of this today. I feel like that should be really broken up over time into talking about each one of these specifically. But the biggest one is education. How much do you know about why your mast cells are irritated? We can't educate the individual enough. I like to tell people you are going to be so much wiser about your condition and how your body responds and what it needs than I am one day, because everybody is individual. Trigger reduction sounds so easy, right? It's so difficult depending on what your main triggers might be. I, laughingly tell people if we could just get rid of all of your stress and just make it go away for the rest of your life, that would be super helpful. But that's what I want people to understand is we can do a lot to reduce our triggers, but we have to understand for all that hard work that we do, we're going to be hit with triggers from time to time that we have no control over. So that's why we want to make sure that we have plans set up in what can be helpful for us. And it can be a specific treatment, whether it's changing the environment, supporting the autonomic nervous system, improving the diet, decreasing that viral bacterial or toxin load, whatever it might be. So this is really working with an individual. And I think this is really important to work with an individual to bounce ideas off of. I think it's very, very difficult in our own care to really see all of the pieces ourselves. So talking about a plan, creating ideas together, trial and error, what seems to be working can be very beneficial. There are a lot of pharmaceuticals out there for mast cell activation syndrome. I'm not going to go down the rabbit hole on that today because it's like a booming industry now on things that can support the immune system in that way. Dysautonomia interventions, as I said before, we have this complex self-perpetuating cycle of the autonomic nervous system and mast cell degranulation dysfunctioning together. Once one starts it up, the other will go. And then it doesn't matter who the chicken or the egg is, you've got both of these things that are not regulated that we're going to need to help out at some point. So sometimes working on the autonomic nervous system can be very beneficial to mast cell activity. There's a lot of herbal and natural treatments and supplements out there, and this can actually work very well for individuals. But again, this is just like pharmaceuticals. You're going to have to sit down and talk with a provider. There's a lot of trial and error, and you want to make sure that you've worked out with your provider what some rescue plans are if you feel like you've reacted to one of those supplements. And then can't stress this enough. I am so happy if we can get people stabilized with mast cell stabilizers, something for mediator support, and we've got things under control. But if there is an underlying thing that is driving the abnormal mast cell activity and we're just spot treating the symptoms that are on top, at some point we're going to need to address the thing that is driving the abnormal mast cell activity. So if that's an infection, chronic inflammation, toxins, whatever that might be, we need to make sure that that's addressed at some point with the individual. So MCAS and EDS, just some statistics for everybody. So it's suspected that maybe somewhere between 10 and 20% of the general population is actually suspected to have some sort of abnormal mast cell activity. And I think if you understand what mast cells do and the fact that our environment has not gotten better for the past few decades, I think you can maybe understand, I can see how somebody can get caught in a cycle if maybe they just had a big move, they're under a lot of stress, they don't like their job, they just came down with a virus, and perhaps they have this flare-up of abnormal mast cell activity. And maybe for the general population, they're able to reset, but maybe there's some people out there that have trouble resetting because of other genetics, whatever they might be. And that could be the part of the population that has mast cell activation syndrome, or the ones that can't reset back to a baseline. The numbers vary out there for those with EDS who has MCAS, and I'm sure we're going to look at this again and again and again over the decades, but maybe somewhere close to most patients, 80 to 90% of those that have EDS have been reported to also have some form of abnormal mast cell activity. Interestingly, another rabbit hole, I'll do upper cervical presentations, but cranial cervical instability, so instability up at the upper part at the spine, seems to always occur with mast cell activation syndrome. And fascinating conversation, again, that will be in another presentation, but there's this overlap in our systems that are working together or dysfunctioning together. There's also, when we look at tethered cord syndrome, in those with HEDS, there's an abnormal mast cell quantity found in the neural tissue. Again, different time I'll be talking about that in length, eye-crossingly, one of my favorite things to talk about. But there is this immune inflammatory response that seems to happen in other tissues of the body. There is a connection between mast cell activation syndrome and CSU, or chronic spontaneous urticaria. So that the reaction on the skin that people have, this urticaria type of response, does seem to be more common with HEDS and in the general population. So this is just some validation that we see abnormal mast cell activity for whatever reason it might be in the individual that has a connective tissue pathology. Some complications to think about, and remember, I'll pick these all apart over time, but just some general things to understand about the crossover between, again, the neuroimmune response with mast cells and the presentation of connective tissue disorders. We have to remember that joint pain can also be caused by or exacerbated by abnormal mast cell activity. So we can't assume that somebody has joint pain just because they're hypermobile. They might have joint pain because they're hypermobile and they have abnormal mast cell activity that's affecting their joints. So please don't forget these things. Mast cell activation syndrome might be causing these gut inflammatory reactions that's going to impede nutrient absorption and can contribute to slower healing as well. So somebody considering a surgery coming up, or that's just trying to work on health and wellness, we might have to work on the mast cell component as well. So something to think about with surgery prep, or if somebody's really intentionally trying to work out of a flare-up, might have to check out the immune system, make sure that we're supported. Mast cell activation syndrome reactions locally at wound or injury sites can slow the healing process. So, and especially if you add adhesives over these areas and the individual has reactions to adhesives. So if you are an individual that has reactions to adhesives, please make sure that you let the person know that is working on your skin that is a thing, because they might have something else to put in that area. Because what we certainly don't want with abnormal mast cell activity is to give you a wound that you might already struggle healing from, and then an inflammatory response on top of it. So it's like a double whammy, right? And that's why some people do end up with infections. So we want to be as low inflammatory as possible to these wound sites. And again, there might be a connection between upper cervical issues and mast cell activity when either the CCI, so issues between the head and the first cervical vertebrae, or AAI, issues between the first and second vertebrae, is diagnosed. I will talk about that in another lecture, but that's the idea of, perhaps there's part of this tissue breakdown, because mast cell activation syndrome can, with a chronic inflammatory response and chronic mediator release, can actually cause tissue degradation or tissue breakdown. And it can, again, correlative, causative, it depends on the person for sure, but it can feed into the upper cervical pathologies for individuals. And then again, this connection between tether cord syndrome with the different immune cells in glial cells. So leukocytes, mast cells, and glial cells were found within this neurological tissue that was tethered in those with HEDS. So there is a neuroimmune response happening within that tissue of those with HEDS. So we just want to make sure, again, that if we're treating somebody for upper cervical instability, tethered cord syndrome, that we are recognizing the significance of mast cell activity that needs to be worked on, if it does in that individual, or perhaps why are they having a neuroimmune reaction in these spaces. So again, those are rabbit holes for me to talk about on another day, but just something to think about. And again, to show you the crossover that happens between systems here. So the considerations when we see all of these things together, right? Because we know that, I forget what the number is. I feel like it keeps growing. Like, oh, this is like a 7-system condition that people have. It can be more than that, because again, mast cells are everywhere, connective tissue is everywhere. So it really is a crossover syndrome. It's not just hypermobility for people. It's this crossover systems efficiency problem. EDS, MCAS, POTS, and GI symptoms, so dysautonomia, gut issues, immune system issues, and this connective tissue problem are typically found together. And from this article, I love this little quote here. While the conditions overlap, they should be investigated, identified, and treated as separate entities as needed in the individual. So again, we don't want to leave anything out. because we've made assumptions or we really want to focus on something. We can focus on something, but we have to keep all of this other stuff in the background or work on it in some way at some point because they're all related to each other. So the physical presentation that we have, I just wanted to pull up the neurological associations again, because again, these systems really work in tandem. So the immune system and the neurological system work absolutely in tandem to, again, support each other or become dysfunctional together. Mast cell degranulation has been linked to headaches and memory deficits. So this neuroinflammatory response that can happen, especially in migraines and the mast cell degradation that can happen within the dura, uh, it could be one and the same for the individual. Again, it's not happening in every single person, but for some people, working on the mast cell component can actually improve headaches, neurological symptoms. So memory, cognition, word finding, poor concentration, brain fog, things like that could be seen with that neuroinflammatory response, right? It makes sense. Your neural tissue becomes inflamed and irritated, and it becomes more difficult to process or use different parts of the brain. Paresthesias, chronic muscle weakness, neuropathy, seizure disorders, changes in muscle tone, so increased tone or spasticity, alteration in sensation, whether it's taste, hearing, smell, or vision. All of these things can actually occur if your neuroimmune system is irritated. It can affect the functioning of your neurological tissue. Dystonia can be present as well, so that's abnormal muscle movement that can happen. Sleep disorders and insomnia, and then neurodegenerative disorders as well. So again, talk for another day. I love talking about neuroimmune inflammation, but neurodegenerative disorders can be exacerbated or caused by this uncontrolled environment of neurological inflammation that could have its start in abnormal mast cell activity, depending on the person. So we've got to be sure that we're working on this. Okay, so to summarize, abnormal mast cell activity might be more common than we previously thought, right? And it makes sense. Our environment is not improving, and nobody is improving us genetically with our filtering systems. So we might be seeing this more common. Some people might be able to work out of it. The people that can't might develop something like mast cell activation syndrome. MCAS involvement can carry throughout different systems and also varies in severity. So it could, and from person to person as well, right? So we have this presentation that can look different in every single person on any given day. And that in and of itself should flag something in an individual to say, I wonder if it's like their immune system or inflammatory responses or something systemic, right? MCAS reactions might affect healing in those that are dealing with injuries or pain. So that's just from the connective tissue side of things. Like we have to remember that, yes, there might be a connective tissue problem, but things can also make that worse. And I think that's where the progression really happens for people. It's not the inherent connective tissue disorder. It's that other things make it worse, and it's hard to recover from that. So if we find support in these other areas, we might be able to recover better in the connective tissue itself. And most especially, this is not just MCAS, but every single thing that we talk about. If MCAS is found, it needs to be treated along with the other conditions that are present. And it's really this balance of working with somebody that understands what a better order might be for the individual. We don't have to work on everything all at once, but is there a timeline? What things should we focus on? But we can't forget any of the things that the individual is dealing with. We have to work on all of them at some point. And I tell my patients, like, that's not necessarily your responsibility, but finding somebody that you can bounce ideas off of that can work this out with you, like that's so beneficial, because you need to keep all of these things in mind so that we make sure that we have the best long-term outcomes and that we have worked on all of the things that need help. Okay, and just some references here. It's probably a lot of references. Oh, and then just some recommendations. So there's not a whole lot out there on mast cell activation syndrome, and I forgot to put Amber Walker's new book on here as well. She has a new one that's more journaling, so finding inflammation really from other areas that we don't necessarily think of. So like stress and how we process what's happening in our lives. I love that little journal. It's a lot of introspection and really trying to figure out if there's any of those very, very difficult things to work on inflammation, like internally, within the way that we're living life, basically. So that's another one, along with all of these that are out there. And there's always stuff that I don't know about. So there might be other ones out there as well that I just don't have listed. But these are some that I have read and I do enjoy. So thanks for hanging in there and listening. Like I said, we'll have other talks on other things and more rabbit holes to go through. But thanks so much for your time.